ACL injuries are among the most common and severe injuries seen in athletes, especially in sports like soccer, basketball, and football. As an athlete myself, I grew up understanding that ACL injuries required surgery and at least 6 months of rehab, but then you're back on the field, right? It seems simple enough. But through my research, I've come to understand the long-term consequences, such as patients are 60% more likely to develop early onset osteoarthritis and may require a knee replacement later on in life. But perhaps the most overlooked impact is how an ACL injury can change someone's life. Maybe you've seen the heartbreaking consequences up close like I did, when my best friend's dream of an athletic career abruptly ended. You see, ACL injuries do not just affect athletes for a season, they can change the course of someone's health and career. So we need to find ways to prevent this injury from happening, and soon, because it's happening more often. That's where my research comes in. As a PhD in mechanical engineering, I've developed a novel methodology and robotic system capable of reproducing real-life knee joint motions on human cadaver knees. I saved you from the gore with a model knee in this picture, but yep, I'm talking about dead legs and robotics. To my knowledge, this is the first system capable of reproducing real-life published data on walking, running, and an ACL injury in a laboratory setting on a human cadaver knee without modifications other than scaling. The system works because I utilized more recently published data that has better measurement of the bone movement, and I identified each knee's natural flexion axis. The system showed that it worked. Basically, the ACLs didn't tear when they weren't supposed to, and they did tear when they were, and in a clinically relevant way. So now anyone can utilize this system to find preventative devices and test them and see if they actually work. Now, I have to tell you something. 4 years into this research, I tore my own ACL while skiing. Can I say I skied for science? While frustrating and quite ironic, the problem is clearly not solved, and I'm more motivated than ever to find a solution, especially for women. Research shows that women are 2 to 8 times more likely to tear their ACLs than men. And in my results, I saw that the female specimens actually ruptured at much lower forces than men. So there's much more to learn, but I don't want to be just another statistic, another female facing a re-injury or have chronic knee pain in 10 years. So I'll do everything I can to now use this system to find the next and new preventative solution. Thank you.